Hello friends, what is the concept of the indirect internal stromal hydration technique to seal the clear corneal incision? Now let me expand upon this concept. This may be the explanation of why in most cases where the clear corneal incision has been constructed well enough, it seals perfectly without the need for stromal hydration at all. One just needs to hydrate the side port incision while simultaneously forming the anterior chamber with very little BSS injections. The inner lip of the clear corneal incision acts like a valve, that's why it's called the valve clear corneal incision. This valve opens when there's pressure from outside, and it shuts when there's pressure from inside. Like when we form the anterior chamber, the valve will close. When the BSS is very gently injected in very small amounts, remember that the volume of the anterior chamber is just 0.3 ml, this will close the valve. Further injection will result in an internal stromal hydration which bolsters the structural integrity of the clear corneal incision. However, rapid and forceful injection of BSS may overwhelm and compromise the valve of the clear corneal incision and cause it to leak. The same effect is noticed in improperly constructed incisions like short tunnels. Let us observe how this indirect internal stromal hydration works in a few case examples. First, the creation of the clear corneal incision. It is done quite perfectly in this case, and now let's move on to the end of the case. While pulling out the coaxial IA probe, I'm gently pressing on the main corneal incision. Now watch carefully as I inject small amounts of balancol solution and see what happens to this area of the clear corneal incision. There is definitely an increase in the stromal hydration that occurs as I inject the fluid, and this will seal the clear corneal incision. Let's take another example. The clear corneal incision is made, and towards the end of the incision, you don't even need to use the cotton bud. All you have to do is just inject very small amounts of balancol solution through the side port. And as you inject, you will notice perceptibly there's an increase in the intensity of stromal hydration occurring at the clear corneal incision. The eye has become rock hard in this case. So this is because the fluid that goes inside first seals the valve, and then it causes further stromal hydration to occur. And let's take a final example in this case. I've come to the end of the surgery, and the incision, you see that the upper lip is actually turned inwards. So there's uneven thickness of the clear corneal incision. Let's see if this incision will seal if I inject DSS to the side port. And as I inject, you can see that there is definitely stromal hydration occurring at the clear corneal incision. Patient moves slightly, and therefore I lost my grip. So injecting further, you can definitely see there's a stromal hydration, and the eye has actually become rock solid and rock hard. I had to let out some fluid. So this is probably the explanation why all clear corneal incisions need not be stromal hydrated, because as we inject fluid through the side port, we indirectly create an internal stromal hydration that seals the clear corneal valved incision. Thank you for your attention.